Indian Contract Act 1872 defines when consent is there. Then I have already taken consent yesterday. This is one of the things. Consent is Indian Contract Act says that consent is when two and more person agree upon same thing in same sense. It can be of implied consent, it can be of verbal consent. So consent has various parts. It can be various requirements like competency of the person, sufficient information we have given to the patient, procedure we have followed, voluntarily understanding decision of the patient. Then we can take the person give the consent. We have some advantages also, that therapeutic privilege, and we can go for the emergency life-threatening situations also. So this all have been covered already in the consent. Examination, head to toe examination, mention the examination of injuries in detail. Type, again I am saying type, abrasion, bruise, laceration. Site is very much important. We have to pinpoint the site. Then size is very much important. Shape is important. Color is important. Most of them color denotes the age. Age of the injury is important. We can write from the color and all changes around that. Direction of the force is important. Nature sometimes we can commit. Duration that we have from the age of the injury. Use diagram wherever necessary. We should use a diagram on the performer itself. Inbuilt diagram, in printed diagram, we can make the sites, and we can make from that we can give the site very clearly. Like this, all the anterior and posterior parts are being depicted in the photographs, and we can write anything here, anything here, or anything here, or we can write this about size, we can write this about fracture. So we can give anything in the documentation. So we have to be very much clear in designing our performers. This is one of the way of taking the, which I was telling in the earlier in the gunshot, that which is one of the way of taking the photographs of the injuries, that it is the L-shaped scale. We can put that and take the photograph, and from here we can say that if you see here, if we see here, if we see here, or if we see here, then this is here, then and we see here, then we can say the dimensions of the or size of the injury, entry wound can be very much easily and can be easily determined. So we should be having a L-shaped scale, and we should take the photographs for the injury directions. Similarly, here also we can see that it is from here to here, and again it is from here to or from here to here. We can see the shape, the size of the injury, and from that we can say that it is very easy. Nowadays we don't have to do it on, we just take the photographs, and later on we can measure it by just on the photograph. Opinion of the patient should be, on opinion we should be very much clear, that we should be crisp and to the point. We should not write that. I see most of the time that the cause could not be ascertained, and opinion cannot be drawn. This all vague terms should always be avoided, because if as a doctor we are not able to evaluate it, we should further evaluate it. If you are not able to give the opinion, we should upgrade our skills on the examination, but we should give something to the police and the judiciary, so that they can act upon that, and you should have trust also in sending the patients for examination. More at a time we say that the cause could not be ascertained. I get most of the time this is the answer. So that should not be done. We should be doing very meticulously, and in my opinion, on almost all the cases have some opinion, and we should be giving on that and to the best of our judgment. Article preserved and should be enumerated. If we preserve something from that patient like bullet or like weapon, like any cloth and all that, then should be preserved and sent to the FSL for examination. Prepare 3 copies of the documents. 1 copy is kept at the emergency room, another is at the hospital, and another is given to the police. If it is accompanied by police, if it is accompanied by magistrate, that is handed over to the magistrate. Then this should be made in a routine way. We should not go for just like go for random things. It should be a routine way of doing the thing in the hospital. General guidelines: if a medical legal record elsewhere in other hospital is referred, it should be treated as MLC, but no new MLC number should be issued. If already a MLC number has been issued, medical legal number has been issued in some other hospital where primary treatment has given and the injury report has been drawn, then we should treat that further. We should not prepare for a medical legal report. We should not do it again, but we should keep that medical legal number and refer to that medical number and register it with that and keep on treating the patient further. Treatment should be continued in old MLC number. New medical number should be prepared. Neither a new medical legal record should be prepared nor it is needed to inform the police, because police has already been informed there where it has been referred as for the first time. In case it is brought several days after the incident, it should be reported and finding to be noted regarding the present condition of the patient. If the patient has reported after several days of the injury, then it should be recorded as a medical legal case. MLCs can be written and signed by emergency medical officer, assistant medical officer, faculty. Wherever possible, faculty member should sign along with senior resident, junior resident if the report is prepared by them, because most of the time junior staffs are moving staffs. JR may be there for 3 years, senior resident for their 3 years, but they may move. So we should be as a senior member, we should be taking the responsibility, and we must attend the code on their behalf and all that. Then that should be, we should take the charge as of that cases, and we should also sign on the case sheet. All treatment papers, investigation report should be labeled as medical legal case record, should be maintained for future medical legal use. Some may be required for court for the further cases. We should not dispose court cases document, and all should be recorded. It has been said somewhere 10 years, somewhere something that. But if it is if we come to know that the case is under trial, then we cannot dispose it unless and until the case is disposed and we obtain order from the court to dismiss it, to destroy the records. So we have to very vigilant. We have to be very vigilant about medical legal records. Belongings of the medical legal cases should be handed over to the police officer, and a proper receipt must be obtained in every case. One should not just hand over anything to the police officer, and should not and cannot, and we should get a receipt from them. We should have a receipt register, receipt and dispatch registered, in which the police should receive the viscera or the document, and we should keep that receipt for the further for the tracing of the evidence. If a medical legal case is not admitted, entry should be made in the case is not admitted, entry should be made in medical register. Sometime a minor injury is there, patient come to the hospital, get treatment and discharge from there. Though it has MLC has not been admitted, indoor patient, but we have to prepare the MLC report. We cannot ignore it, MLC report, and we have to register it there. Consent for emergency surgery when no attendant is available can be given by the medical superintendent of the hospital, that I discussed in the concept of loco parentis, that consent should be there. In case of taking away the patient's body for medical case forcibly by the attendant, the officer should record the same. Sometimes the patient is being taken away from the hospital or that left against medical advice, then he should or doctor should write it in the case file about the incident and that the patient has left on his own or left against medical advice, and then LAMA form, left against medical advice form, should be filled and attached to the medical legal report. Otherwise, the doctor may land up in trouble because of that. He may have fled the patient to somewhere else. Police station, post of the area and security staff should be informed immediately. These all should be activated. If any under trial patient is there and he left without doctor's advice, then chances are there we are in trouble. So we should always try to document the things, and we should always have the authorities informed. X-ray, blood reports, microbials, pathological investigation, etc. in the medical legal cases should be labeled as MLC, kept along with other documents of the MLC reports. Here X-ray is very much important because most of the time the fractures are being re-evaluated, and many times other investigation report like pathological report, investigation report, blood report, these all should be documented in the case of a medical legal case. Always prepare 3 copies of medical legal report, one for the hospital, one for the emergency, and one for the police. Though hospital record or file for MLC should be kept in confidential record section. This is another thing we should have already. Every hospital should have a record section division which maintains the record of the patient, whether it is MLC or non-MLC. If medical legal report has already been issued, then the duplicate medical legal report should not be issued. Duplicate medical legal report should not be issued unless it is warranted by some of the most of the time it is not required, and we should not issue the duplicate medical report in any circumstances. Death in medical legal cases. Various deaths happen in medical legal cases, and we have to be apprised all the situation. When there is a death in the medical legal case, the police officer should also always be informed. Body must be sent to the medical legal autopsy after filing the appropriate format. Dead body challan and all that, we send the body to the autopsy. In all the cases, broad dead, police is informed and body is sent to the mortuary. Broad dead is there, police is informed and body is sent to the mortuary. In some cases, the person is alive and want to say something about the incident of his injury, about something in his life, then he can call for the dying declaration. Dying declaration means person is on the death row and it is on the notion that he will not lie at that moment. So his or her statement is recorded, and it is mainly recorded by the magistrate, or if not available, time doesn't permit, then the medical officer can record. Or the main role of the medical officer in dying declaration is he should maintain that the patient is in composed mental status, so that he or she may not be in the altered sensorium and all that, and can give the proper statement to the magistrate. Dying declaration may be recorded by doctor himself in the presence of another doctor or staff if time is limited. Time is the factor which allows many people to record, but we should always rely, if time permits, on the magistrate, call magistrate and get the dying declaration done. Primary duty of the doctor in dying declaration is to ascertain and document the composed mentis, alert mental state, I said earlier, alert mental state of the patient, and at the beginning and at the end of the statement. So we should be just observe the patient's mental status. Specific cases, firearm injuries, bullet, lead shot, etc. required from the wound or the body in firearm injury should be air dried, should not put in the bottle, padded with cotton, documented, and the forces with which we pick up the bullet should also have rubbers on their tips, because that serrations of the forceps can give another impression on the bullet, and that can lead to alteration in the findings or matching of the bullet to the gun. So in the sense that we should not further scratches or further damage to the bullet in any case, and we should always try to minimize the further damage to the bullet in any way, and that may hamper in the further matching of the bullet. Always try to mention about the entry and exit wound if possible. Always take X-ray of the track or whole body. Never pick the bullet using metal tooth forceps, rather use fingers or rubber tipped forceps. Never wash the bullet. Bullet should not be washed. Burn, proper history and documentation. Give primary treatment, extent and degree of burn should be noted, because most of the time the percentage of burn is more dangerous, because it leads to more dehydration and can lead to that also. Anything about 30% or 50% can be dangerous to life. Make a proper sketch of showing involved area in a state of percentage. I have already said one should have a proper diagram of the person, and we should give the percentage of burn of the person. How much percent is the burn? Inflammable agent, if on the body present, should be recorded. Sometimes we get the smell of the kerosene, sometimes we get the smell of the petrol or the diesel. Some smell is there, we should note that, and that may be helping in future. Dying declaration, if required, should be arranged in a married female in India because of the dowry death scenarios. This is one of the case of the burn that has happened in the abdomen, chest and the right arm. Hanging and ligature marks, we are again come to the certain points in our practice that patient is saved in hanging, and if parasuicide case happens and the patient is brought to us in the emergency, and we just examine there, and patient may be treated and recover. Sometimes it happens mostly in the females. Ligature marks should be described in position, nature, width. Position for hanging, nature, it is very rare to comment. Width is important, direction is important, extent, whether complete or incomplete, this is important. I will show you then in the next slide. Ligature material in situ should be cut away from the knot. Knot should be preserved, because sometimes knot, if we are very good expert, we can say that it is which type of knot. We can say that it is a right-handed knot, or it can be left-handed knot. Various things are there, we can give only from the knot. So knot should be preserved. Any cut in the ligature is made, it should be away from the knot, and knot should be preserved and not disturbed. Then the cut end should be secured with thread. Both the cut end should be secured with the thread and kept in the preservating material, polythene and all that. Examination of ligature material should be done, and it should be given to the forensic science lab, and they can examine the material, they can examine its elasticity, it can examine its fiber, it can examine its various nature, its strength, and they can come up to certain conclusions. So it is the FSL part, but we should be aware that material should be preserved. This is the hanging case, one of the prototype of the hanging case. Ligature furrow elevates back to the side of the neck, behind the neck. It is generally it makes this type of, in case of hanging, it makes this type of the mark, and is almost incomplete in most of the time. In strangulation, it is always the straight most of the time. At the thyroid cartilage, it is above thyroid cartilage. So we should have a broader term differentiation for these two things. Injury cases, give primary treatment, examine and record all injuries properly. Proper documentation is there. Opinion should include injury by the type of weapon, sharp, blunt, manner, self-infliction, homicidal, accidental, duration of injury. These all should be examined, and we should be very much prepared for that. Drunkenness, this is another scenario in our setup that we generally use to examine the drunk person, and it should be carried in under the police supervision, and it should be, consent should be obtained in section 350 section 53(1) CRPC, and some request police for the in helping the examination. Should be urine should be collected for sampling. Mention start and ending of the time of examination. Never rubber stop. It should be means there is already alcohol in the system. So we should be having a glass bottle for examining the urine. We should not be having a rubber cap. We should be having cork cap. So that the alcohol level is not disturbed. So we should always be vigilant, and we should not use syringe or cotton that is having a spirit in itself. So we should avoid spirit in that, and we should get the sample there, and we should examine and trace the evidence of the alcohol, and we should be very vigilant. It should not be mixing. Drunkenness has been taken by some of our other colleagues, so I am not going into its detail, but the examination part, the medical legal part of it, we should be knowing that. Poisoning cases, again, primary treatment should be given, proper history should be recorded about the substance consumed, or number of people who have consumed that, proper documentation of history, treatment article sealed, send properly sealed article to the FSL. Never allow entry of an unauthorized person near the victim in a case of homicidal poisoning. In case of homicidal poisoning, we should restrict the entry of the person to the patient. Child abuse, we have already gone to the battered baby that they should be given a proper sensitive treatment. They should be given a counseling. They should be observed. We should record the child weight. We should get the history of sexual involvement, and the proper history should be documented properly, and we should always inform if we suspect there is a child abuse, then we suspect the child support authorities we inform the child support authorities so that child should be further taken care of. Always prepare the child by explaining examination, showing equipment. We should get the patient familiar. If possible, interview of the child alone. Psychiatric counseling should always be there. Never put undue pressure on the child. Avoid unnecessary, painful or invasive procedures. Criminal abortion. Again, we have various ways of doing criminal abortion in days. Still we are having. Nowadays, generally we don't go. Generally, we have medicinal induced criminal abortions, and not old methods of criminal abortions are going on. So we should give the proper treatment. Always perform examination of the clothing, blood and sample, proper history and documentation. If patient dies in criminal abortion, then we have to inform to the police. Preserve remains of product of conception for chemical or DNA analysis. Clothes are recorded and preserved. Rape and sexual assault victim, it's all a total whole new different phenomena to do that, and we should be very much vigilant in examination of a sexual examination, sexual assault survivors, and detailed history is there, detailed examination from head to toe is there, detailed local examination is there, and there is a proper guideline who will examine it, who will not examine it, and there should be always a SOP in the hospital for doing that, and there should always every institution should get a one-stop crisis center for the sexual assault survival victims, survivors, and we should have a proper facility in the under one roof to examine them. If she refused to give a statement, the doctor should not pursue for statement. Here one of the thing is that if person gives the consent for examination, then we can examine only. If person doesn't give the consent for examination, we cannot examine the patient. And the another thing is we should not push pressure on on doing some of the examination part. It is totally her will to do that, but we should explain that if she not gives consent for examination, the evidence of the sexual assault may be lost with time. Following instruction to be followed: take history whether he or she taken bath. Again, that will help. Whether if she has taken bath, then the chances are that some evidences may be lost. With cotton swab, collect vaginal secretion. Place closed pubic hair in the loose pubic hair in the label envelope. All this, that is a part of sexual assault examination. We get a kit for that examination, that is a sexual assault examination kit, and we have all the things labeled there, all the gloves, necessary equipment in there, and we should follow the instruction in the manual there. And we have to be very much vigilant that none of the evidence should be lost, and we should be very much important in that is that we must be very much sympathetic to the patient, and we have empathy for the patient to develop something. And there is age estimation in our departments are going on, which that if may be medico-legal case or may not be medico-legal case, or it may be civil case, and we should be doing that. And age of the victim, of the survivor of the sexual assault should also be ascertained, because if she is minor, the charges are different. If she is not minor, then the charges are different. If she is under one age, the charges are different. So we have to examine the age also. As a forensic person, we should examine the age of the survivor. This is one of the medical death certificate documents. We already know that what a death certificate means. Immediate cause, what has done, then the antecedent cause, what has gone through, then we should go for we should go for on the certification and all that. It is already the repetition of the which I have made in the injury report. So one of the way to determine the cause of the death. One of the immediate cause may be shock and all that. Antecedent cause can be because of the disease, which because of the injury which has already made the patient to admit. Another significant condition that had developed during that time. Then, how did the injury occurs? We have to write homicide is there or not. Suicide is chances of suicide is there or not. Pending investigation, we have to write it. If disease was female, was pregnancy there associated with that, delivery is there or not, we have all write all in the this format. We should not leave any of the format blank. So blank format is one of the drawback to us. We should fulfill all the things. We can take separate lecture on how to prepare a death report, disease death certificate. All the certificate can be taken in the separate lecture. We can come up with certain course with that. This is another medical certificate for the cause of death, similar thing. Then it is which have we cause as the causes of death. It is the disease condition direct leading to the death due to the maybe the shock. We can say the death, cardiorespiratory arrest. It is most of the time the cardiorespiratory arrest. Then antecedent cause means the injuries or something with head injury, unconsciousness. This had lead the patient to admission. Other significant condition like septicemia has developed. So we can show that approximate interval we have to write here. So we can take a separate class on that, how to prepare the reports. And basically this course was designed for the injury reports, and in making of the injury report. If you want, we can come up with new course that death or post-mortem. Then we can go for the post-mortem course also, depending upon the demand. Example, one of the other is a woman 59 died of asphyxia following inhalation of vomitus some hours after suffering from cerebral hemorrhage. 3 years previously, she had been diagnosed as having adrenal adenoma with aldosteronism, which manifested itself as hypertension. Congestive heart failure was also present. Then asphyxia by vomitus, minutes due to cerebral hemorrhage, hours due to hypertension, about 3 hours due to aldosteronism 3 years back, adrenal adenoma 3 years plus. Extra lines have been added, part 1 to complete the consequences. Various ways to complete the death certificate, and we should be aware of that. We should not leave anything blanks. With this, we come to our course end, and thanks to the whole of the team which has come up with this idea, and who are gone through various pains in taking recording of these lectures, various pains in the formatting and all that. We are thankful to the whole of the team and the computer science department and other. We should be thanking that they have come up with the course, and we involved everybody, and we have gone through this and tried to do something and tried to reach to the masses with certain type of courses, so that they can educate themselves, and things get better in the future. Less mistakes in the preparation of the injury reports, less mistakes in the presentation of the case, our presentation of the cases in the court. So thank you very much. With this, we come to the end of this course, and we will be coming up with certain course in the future. Thank you very much.